personal health and wellness applications, both web-based and mobile, for the health and wellness industry. So their platform includes customized content and a so-called social support layer that turns it into a community-based solution. And I read that last week, Wellness Layers actually announced a partnership with WorkOutWorld, which is a 10-club, New Jersey-based fitness club chain, to release a custom portal for customers of that club. So that's the kind of thing they're working on. And Lucy Reynales, who's Director of Sales and Marketing, will now share the Wellness Layers approach to community building with us by demoing 4 recently deployed community environments.
Thanks very much, Amy. That was very well put. So I am Lucy Reynales, and I am the Director of Sales and Marketing, and they saved the fast-talking New Yorker for last, so hopefully I can keep you guys engaged for a little bit longer. Actually, Wellness Layers has been building online and mobile community, customer-patient communities within health and wellness for the last 15 years. We're not that new. And what we've really found is that social is not one size fits all. So what that means is that patient needs and the customer needs are much better met if the architecture itself is customized to those needs. So to give you a sample of that, I'm going to try to share with you 4 systems, the social layer of 4 different systems that Wellness Layers has recently deployed. The first one is in partnership with GuidingStars, Healthy Guidance Nutrition System for Delhaize America. And here, it's social grocery shopping. So we asked ourselves, what will be the social experience for shoppers? And the answer is that you can share, you can build and get the healthy nutrition ratings for your shopping list from GuidingStars, but you can also share recipes as well as share your grocery shopping list and do meal planning. So it's all Web 2.0 and very social, specific to shopping. Second is social hospital. So here, as patients, we all have, at any given point in our lives, we have different needs. And at the hospital, what we're able to do here in partnership with PinnacleHealth, now, based on my needs, I can actually select if I am an expecting mother, let's say, I can change the entire system to let me find, learn, and share with other expecting mothers. So it's very personal to me and what I'm currently interested in at the hospital. Third is, which Amy mentioned, in partnership with WorkOutWorld, we launched a social fitness portal. So as a member of a fitness club, who would you want to connect with? And the answer here is that I want to connect with other people that share my fitness goals. I want to be able to, so we created groups based on goals. It's, so here, if I want to fit into my little prom dress, I can find other people that also want to do that with me. Lastly is going to be social dieting. So in partnership with Nutrisystem, we created this online environment, which is, it has really big here, you know, what's my Nutrisystem moment. Dieting is all about sharing your own success and connecting with other people to help you and give you emotional support for your weight loss journey. And why do all that? Nutrisystem is a great example because you can see that their Facebook page has 20,000 members. Well, their online community that Wellness Layers created has over 4 million in the same amount of time or even less. So you can see here that social is not one size fits all, and that there are many opportunities to structure and preserving the essence of what you really want to offer your patients and customers and what the true value of your business is, to make sure that that social system and the social layer is going to create the most value. Thank you.
So this is probably a good question to ask everyone later on, but you're talking about creating these sort of private, care-specific architectures. What about tapping into Facebook, Twitter, you know, some of these topics that you're discussing don't seem to be super private, kind of deep health conditions, or rather they would things that would lend themselves to being able to use those more widely visited sites. So what's the relationship there?
Yeah, great question. We will
integrate with Facebook and Twitter. Obviously, Facebook, there's a lot of great big audience there. But the one thing that actually Karen mentioned earlier is that we still find, even if it's dieting, that Facebook is really the wrong destination to share your personal health challenges. And within health and wellness, the biggest reason that we need community so desperately is because we all need emotional support and feeling not alone, which many of the things that the other speakers mentioned. So Facebook is great. There's some opportunities to be fun and social and integrate with it, but for the most part, if you do the private, again, 4 million versus 20,000, it's 200 times the engagement if you do it right.